Welcome back, everyone, to Value Based Care. I have Dr. Chadi Nabhan with me today, and I'm so appreciative of having you on my show. Thank you for gracing me with the honor of your presence. I listened to your podcast, so it's really a great honor.
Thank you, Kim, and congratulations on this new adventure. I have no doubt it's going to be absolutely amazing. So congrats.
Oh, well, thank you so much. You've always been incredibly generous, and that's what really struck me with you is you're so authentic and very genuine. When I first met you, it was earlier this year, and we were at a conference, and I remember you were moderating, and I remember thinking, like, just the way that you were presenting yourself was very much like I could tell this is how you probably always are. And so it was not usual for me to go up to someone and just say, "Hey," but I felt like I really had to. And I've continued to just be so impressed by how honest you are, especially on a podcast. I think it can be easy to get thinking like, "Oh, I better change what I say a little bit, or I need to think about the audience a little bit." But I really love listening to your podcast, Healthcare Unfiltered. I like the byline where you say honest and timely conversations. And I wanted to ask you about that because I think there's a whole story behind that of why you were thinking like I want to do this now, or like 6 years ago you started thinking I want to do this. So I'm really curious about that story.
Yeah, I mean, first of all, thank you. You're very generous with your compliments and kind words. Truly, thank you. I just to back up just a little bit. I think it's much easier to go through life by being who you are and being authentic, and as opposed to trying to have various personas depending on the situation or depending on where you are. Just being yourself and being true to yourself is much easier to be to it allows you to carry on with life easier, frankly. The podcast story is a bit interesting because I started podcasting actually in February 2019, and the original podcast name was called Outspoken Oncology, and it was very focused on oncology specifically. And I did get a chance to have leaders, mentors, and clinical updates and things of that nature. But then I rebranded that in 2020, and I called it Healthcare Unfiltered. And because I really wanted to cover other aspects of healthcare that may not be oncology centric or cancer centric. This would allow me to reach more people and and really communicate other topics that might not always be related just to oncology. Think of policy, healthcare policy, Medicaid expansion, 340B, any other things. And I was thinking, how do I really frame the podcast? And I think the name tells it all, which is unfiltered. I really wanted to create something where there's no edits. There's really two people or three people or four people having honest conversations, because I think listeners, really crave that. Listeners are very smart, and they can tell if something is just too polished. They can tell if something is a bit disingenuous. They can tell if something is too scriptic. And I wanted just to get rid of all of that. So I wanted to make sure that this is completely unfiltered conversation about something related to healthcare. And the other thing is that there's so much noise when it comes to healthcare. There's a lot of noise out there. And for viewers or listeners, or especially patients or families, they could struggle in differentiating signal from noise. So I found myself, maybe there's a way that I can have a platform that allows me to reach people and help them separate signal from noise. So that was how Healthcare Unfiltered was born, and it's been quite a journey. as you are embarking on your podcast, you're going to see there's always ups and downs, but perseverance and staying core to the mission and to what you aim to achieve in the podcast is the most important thing, because there's a lot of podcasts out there.
And it seems to me that the aim that you're looking to achieve is to really remain that authentic voice that people are starving for, where you're talking about those topics that you feel like, how come there's not more around it? Like you're talking about like the 340B, for example, I think a lot of people try to stay away from even. And it seems like you care a lot about community, like healthcare is a community. And so I'm very curious in terms of your aim, and if you feel truly that this aim is a part of uh, almost like conjuring folks to show up in community. Like, what are you thinking in terms of the evolution of your change making vision in your work?
One of the most difficult things as I, what I encountered, and obviously I'll be very curious to see your experience as you embark on this beautiful journey. Um, but but the most difficult thing is always having content, and content that is relevant to people and that is communicated effectively to people, whether they are listening or viewing. And content is not easy, especially if you do weekly. I do weekly podcasts every Tuesday. And you have to always almost stay current into what is really getting the interest of people. Um, so what is really happening? So you gotta be like, on social media, what are people talking about? What is really happening in the ecosystem of healthcare that is gonna lead people to really listen? So you have to really do that. Um, so the content is key, and it can't be always repetitive. I mean, as an example, I'll give you an example. There's a lot of happening in artificial intelligence right now in AI. So I have several episodes on AI. I did one 6 months ago. I called AI as a primer, and I actually had somebody who worked for Microsoft, and we talked about what is AI and tell me. I mean, so basically trying to help the healthcare people to understand more about AI. This week's episode about AI now in the future, and I talked to someone who is trying to explain generative AI and what's happening also in the AI world. I happen to have an episode on AI and clinical decision
Mhm.
making. So how AI helping physicians in the clinical decision making, and I'm talking to an internist at Stanford who is really an MD, PhD, his PhD in computer science and so on. So I kind of felt like these are really important topics to bring in. At the same time, in the world of oncology, Kim, as you know, we have so many meetings and conferences, and oncologists are struggling sometimes staying up to date with a lot of these things. So I kind of find myself, well, I need to also do some of that. Like it's very hard not to do updates on breast cancer, updates on lung cancer with all of these meetings to help the clinicians who might want to be driving and want to listen to something just to get quick updates on something. So I created a new product called Healthcare Unfiltered Express. And basically, these are 10 to 15 minutes snippets to cover conferences, cover data, cover papers, or things of that nature. And I do that sporadically throughout the month or throughout the quarter, depending on what meetings are out there. But I think it's about content. And lastly, I will say you have to really bring the right person that addresses that particular content. um, because I'm not an expert in everything. So I need to bring someone who is an expert so the listeners and viewers appreciate that. So the show is really about the guest usually.
Sure. Yeah, thank you for letting me look behind the curtain. And I've seen that you do many things. I mean, the podcast is definitely a large endeavor, but you also write books. And I know you recently had, I think it was a JAMA article too. So, and I noticed that it has some underlying similarities. Like they're different media, but you're doing a lot of that, like listening and empathizing and trying to see what do people need, and then you're trying to anticipate how are you going to help meet that need so people can be more prepared for an uncertain future. But with your books, what I really and all your writings, I'm very, uh, it's remarkable to me how much you love stories. You tell a lot of very, rigorous medical information in the form of stories, and I appreciate that because I think in the medical world, we're so literature heavy and jargon heavy, but you really want to humanize and bring back that, that sense, like, the truth is even more true when it comes out as a story. So I was curious, how does that form of communication, how does that come about, the origin of that intent for you?
I think we all gravitate to storytelling. Like all of us, we as humans, when I tell you a story, it resonates with you more. So you remember the subject if I'm telling you a story about it. As an example, if I want to tell you about a meal that I like, right, or a type of food, and I frame that to you in a story, you know what, I went on vacation. I don't, but I should. I went on vacation to this beautiful town, and it's just I described to you what happened. And I went to this restaurant, and the waiter was really very nice, and the owner happened to be from Morocco, and he came into all of a sudden there's a story around it. But in that story, I'm trying to convey to you something about a particular type of food and so on. You are going to remember that story. And when you go home, you talk to your family, your relatives, your friends. Because I told you this in a story, it just resonates with you. If I just tell you the same exact thing in a flat way, in a very like just, I had a good meal and this was, you may forget that. It's the same thing with patients. When you have a patient in the room and you are talking to this patient about a particular um, therapy and you want to discuss the side effects of the treatment, you can list those side effects 1, 2, 3, 4, 5, 6, or whatever it is. But what do we normally do as physicians when you communicate? We actually do it differently. We say, you know what, there's a lot of these side effects that we read in textbooks. However, the last few patients I took care of and I gave that treatment, one of them had this, like you just do it in a story way, and patients will remember that. We gravitate to stories. Um, if you when you have a if you have a if you just go on a stage and you have a PowerPoint presentation and you just start with slides, people will yawn and you may lose them right away. But if you start with a story, everybody pays attention. There's a story that you're saying, and people want to know what happened in that story. So I think storytelling is very important to communicate the message that you're trying to do. And the second book I wrote, which is The Cancer Journey, I've always wanted to explain cancer to everybody. I mean, we deal with cancer as a disease, we deal with patients, with families. But if I can communicate the actual topic using stories, people who read it are not going to get bored. They're going to actually understand because they will resonate with the story. You know what happened in our brain? When I tell you
Mm.
a story, you start imagining yourself as a character in that story. Like literally, if I tell you, I went to this restaurant and I described the restaurant to you, it's downtown Chicago. All of a sudden, what you're imagining how you've never been to the restaurant, but I've just described it to
Mm.
you and I told you what happened. You're imagining the restaurant without ever being there, and you imagine yourself going to that restaurant and eating in that restaurant I'm just describing to you. So we just love storytelling, and I personally think that the only way to reach large audience and more people is by simplifying complexity, and the best way to simplify complex topics is using stories and storytelling. I don't think I know how to do this very well. I think I'm learning how to do it. But I certainly believe it's the best way to capture more people who want to really listen to you and consume information. Otherwise, it gets boring. Just PowerPoint or like just lecturing is boring, I think. If you're Now, it's important to medical students and residents and fellows, But if you're reaching broad audience, if you're reaching the general public, you want to do stories telling to be able to capture their attention. That's my opinion.
Yeah, and I think of as you're saying this, that there's a very unique, quality about what you're saying, though, which is, you really want to connect. You're not just storytelling, but it seems like you really want to truly connect with people. Like, I think I remembered when you were talking about your second book, and I think it was an interview with Leukemia Lymphoma Society, and you were saying that you wanted it to be kind of like another doctor that a patient could have. And I thought that was so unique that you took 2 years out of your life just feeling compelled to be that support for someone. Like, you care so much about connection and you want to make that kind of impact. And many of us doctors do, but that just really stood out as a very unique quality to me. And it seems like you put in that extra thought in everything you do.
You're very kind.
But it do
Truly, you're very kind. Thank you. Thank you. I think we all try. Taking care of patients with cancer is a privilege. Um, and I think there's care in the exam room, and there's also ways to provide care and show that you really care about these patients outside of the exam room. And hopefully that book was just a way to help people just understand certain things that when they embark on that journey, the unfortunate journey, it becomes as a guide or something to help. I think physicians would like it too, not just patients. And I think nurses, pharmacists, everybody would find something in it, whether it is the way I communicated certain things to patients and I just put it out there, or whether it is just to see if certain things resonates with them the same way they resonated with me. But yeah, I think we all are trying in our different ways to make a difference for the patients that they trusted in us.
Yeah, and I really love how you mentioned that it's not just patients, it's also us. And we do have this, vehicle of learning and training that's very PowerPoint oriented. But I'm curious about what if we lived in a reality where our communication is treated as not so much the afterthought, but it's very much its own skill. And storytelling sounds like that's one of many skills, but if it's something that we're learning, like employing, how do we use storytelling to educate patients? And that may even help us feel even better because of things like burnout, or we feel like we're hearing a lot of things that we label as misinformation. All these things that really maybe we could actually address in a positive light under the skill of storytelling, like what you're saying. But we don't really formally get that in our training.
Yeah, I think communication is an important the way we currently learn about communication is usually shaped by the people we work with, our mentors, and the people that we have seen how they communicate with patients and families. When you are a medical student or a resident or a fellow, you have worked with many people who have taught were your teachers or your mentors, and you see how they interact with patients. You see how they interact with families. And then you pick one attributes or one trait from one and one from another, and you learn, and all of a sudden you're building your own persona into how you actually effectively communicate. I'll give you a story. So you're talking about storytelling. So I had a dear patient, like I never forgot this. So I have a dear patient of mine who I forgot, maybe he was an engineer. And he, he did actually well. And, but I think he perfected the art of communication. So a couple of times he would pick on certain things I say, and he said, like, hold on, doc, probably this is not the way you should say it, like literally. And I would let, and I'll give you an example because I'm sure you say the same. because I still make that mistake. So I would be with him, and he would say, give you an example. I would say he would say, so what should I expect? What should I expect in terms of side effects or something like that? And I would say, frankly, to be honest with you, I think it's going to be fine. I don't really I doubt it's going to be any issues and so on. He would stop me. What do you mean to be honest with me? Aren't you always honest with me? But think about that. How many times do we say, frankly, to be honest with you? Well, what does that even mean? He said, well, so he said, okay, well, tell me. He said, I hear this all the time, but you doctors don't realize that this is not, makes no sense. You are always honest with me. So you should really not say that. And I think the majority of doctors, I think, will take offense to that because, I mean, you and I know that sometimes there are certain physicians that think they are just, a couple of steps above God. Um, I'm thinking, this is really true. Why am I saying to be honest with you or frankly? Um, or sometimes you don't say that. Some people say, if I'm being honest with you, well, why wouldn't you be honest with me? Like, I mean, if you catch yourself with certain phrases we do, if I'm being honest with you, blah, 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 blah. Well, okay. How about you being dishonest with me and tell me then what happens? But this happens in the exam rooms across America all the time. And it takes a level of emotional intelligence to be able to catch yourself and correct it and so on. And I think we had this kind of bond where he felt very comfortable telling me this because I wouldn't take offense to that. I mean, I'm like, damn it, you're right. And then, it's every time I would see him, I'm like so measured in terms of the words I'm saying because I know he's gonna actually catch me on anything I say. I'm like, oh man, I need to make sure like he doesn't really. And it was actually pretty funny. And a couple of times I saw him with his family, and apparently he does that to his family as well. Because but certain things we say is just common. Like this is how we just interact, even in real life. But I think when it comes to patient care and in healthcare, there are certain things that we can tweak that I think is really important. And the art of communication is key when it comes to social media, when it comes to a lot of these things, because patients and families read these things. They read LinkedIn, they read social media, they read Twitter, they read Instagram. And if you are saying certain things are very insensitive, they're going to call you on it because, like, well, I mean, this is really insensitive for a lot of patients. An example of this, and then I'll shut up. An example of this, if somebody is completely trashing a clinical trial. Well, but what if I'm a patient who was enrolled on that clinical trial? That clinical trial may not be perfect, right? It's not everything is perfect. But I think it's the way you communicate the imperfection of the clinical trial that's key because there are patients and families who invest the time, effort into being in that clinical trial. So you want to be sensitive to their participation and to the fact that they really invested in that particular study. So the way you communicate its imperfection is key for the people who are reading about it. It's a long
And
way
I
to answer. I'm sorry. I think
no,
I digress a lot.
no, it's if you're on a roll, then why wouldn't I just sit back and laugh? I could never cut you off,
It's your
Chad. That would be
show,
so.
Kim. It's your show, Kim. Cut me off. Trust me.
Oh no, but I mean that I think that's really a perfect segue into the question that I have in my mind of what is really masterful communication. And I love how you even said earlier today that you may not feel like you're the best at it, but really anyone who's truly trying to master something, probably they're going to have that humility that they're not ever going to be the best. They're only ever going to keep being curious and aspiring. What does better look like? Because it will always be better if you keep being open minded. And then your patients are, it's like they're giving you free intel or feedback, and you look at it like, they're helping you grow. And so I think that's a really wonderful gift to your patients because they probably feel like, "Oh, I have this very unique doctor that I'm as a patient teaching my doctor," and then you're connecting so much quicker, that trust is building so much quicker, so, uh, I'm just listening to all the different ways to intuit masterful communication, but then also wanting to do that hard work of how do we quantify that? Like, how do we now create chunks of it so we can go teach to the next generation to embody this kind of mindset? And I think a lot of what you do is kind of like that teaching.
Yeah, I mean, I think we do need to invest in teaching the future generation of oncologists how to improve their communication. I also think we have to be mindful of the fact that we evolve. Imagine yourself literally the first year of medical school when you were taking your history and physical for that patient. You're probably trembling and not even sure what to say versus now. So we do change, we do learn, and it's a journey. It's impossible to know it all right away. But what's important is to learn from our mistakes and to keep learning. That is really, really important. And then once you learn it, to try to effectively um, teach it. One of the things is that, two things I will mention: communication, like email communication. We live in the world of email back and forth. And I think we have to, there are certain things in emails that I just don't like. I don't like, but so I tell people, you could say the same thing, but maybe crafted differently where the message is coming across, but the way you communicate this message is going to be more effective. Especially with email, you're not seeing the person. When I'm talking to you, it's very different. Well, in an email, all you have is just 3-4 lines actually being sent behind the screen. And these lines are going to tell me a lot about you if I've never met you before. And if I met you before, it's going to tell me about your mood and how you're feeling and so on. But these are quirky things about me. Like, I don't like to say the word thanks. I like to say thank you. It's very simple. I just think thank you is more personable than thanks. Now, there's nothing wrong with thanks, but this is me. Like, I like to say thank you versus thanks. Um, I don't like in an email, there's like always like this, it's the same email signature. The signature is fine, but there are sometimes, there's always like regards or best regards, and that's it. And it just seems like it's the same thing for every single person versus, you could just personalize it. Like, these are things, there's no right and wrong. This is a style, but that style evolves with time. And I think what we need to teach students and residents is these nuances of certain things. And I think that we could do simulation exercises, like you could just talk back and forth to an AI or a chat bot and see how you can communicate effectively or not. I imagine that this could actually help a lot of residents and students improve their communication skills.
That is so spot on. When we're talking about communication, it's not just the tone and the uh, body language and all those things are important, but yeah, we're in an era now we have to think about how do we come across an email. And I think there's a lot of taking for granted that, oh, just because it's email, we can almost do anything we want and it should be acceptable. But you're right, there's a personableness to it for those who want to add that extra time and thought. So that's very interesting to think about that angle because there's also the etiquette with the email. Like how many times or how fast do you respond? Like how many times do you respond? Or like text message very similarly too. So there's a lot of this like how should we communicate to each other? And I really like that idea that you're just putting it out there. Like now I know in my email to you, I will never say thanks. No THX, none of that garbage.
Yeah, but it's not, there's no like hard rules. It just depends on the situation. I don't know. I mean, like like I said, there's no right wrong. Thanks is thanks, right? I tend to use thank you. I somehow in my mind I'm thinking thank you is more personable than thanks, but maybe I'm completely off. Like I don't know. It's maybe completely off, and I think it depends on the situation. But I'm not saying there's right and wrong. That's why I'm saying it's a style, right? It's a style. You have to end up crafting your own style, um, and um, and I don't think anybody could teach the style. I think the style evolves from everything you've learned from people plus some formal training. I think the training is going to require these simulation exercises. Like just tell the students, have a chat bot come on the screen and imagine that's like it's an angry patient about the fact you had not returned her call over the past week, and let's have a conversation. I mean, it's creating the scenarios where people have to really figure out what to do. It's almost, I mean, people, they do training in customer service all the time. I think I think there are ways to improve how we communicate across the board.
Yes, and I also think about, like you mentioned style, that we probably have patterns as human beings and how we're wired, like buckets that we fall onto, at least to guide how to read the audience. So there's different ways like personality tests or like just grossly putting people into, are you someone who is more relationship based or are you someone more fact based, or and being able to think about it like I'm talking to someone who has this kind of style. And so it's not just how I want to talk, but also if I want to have an impact with this person, I need to know their style and adjust myself so that they're going to want to listen. And having that, what I consider as empathetic communications, I would love to have a chatbot or another person with a chatbot refereeing us or simulating your patient. Like, oh, you just said to be honest, back up. But yeah, that would be quite the future. That's
So
if that's the future.
you're gonna remember, to be honest, because I told you a story.
Yes. And now the next time I
That's
say it,
remember that because this was a story.
yeah, and then I'll cancel myself. I'll be like, "Oh, I would never not be honest," and then people will
But
wonder why I'm
it's
talking.
something that we just say all the time. I mean, we say it a lot of times. It's just we don't think of it this way, but I think in healthcare setting, it obviously falls differently on certain people. So he was coaching me about this.
Yeah, and Chadi, I just wanted to ask one more question because I feel like I could take your whole day's time and you would be so generous and just give me your whole day. But I I noticed that you really think about the future. And there's people who talk about it like it's their job. There's futurists and I find that to be such an interesting field, but for you, it's subtle, but you're anticipating, you're thinking, and you're trying to see how you can help other people, how you can pull together a community of who wants to show up and be a part of this learning mindset. And I've heard this term coined and you may have heard as well. So we know this term already called FOMO, like the fear of missing out. And then there's this newer term, this FOMA, like a fear of missing anything. And that's where everything is coming so quickly. Like there's AI and there's like quantum and everything is changing and the fear of, oh, I better actually early adopt because I don't want to, now I'm going to be behind everybody on everything. But even that is going too extreme because that discernment and that authenticity and that like reflection of, well, what are the things that I should be picking and choosing that really matches my style, like you said, like what is compatible and what will make me more impactful and more of a contribution. And I notice you do that. Like you are very stabilizing, especially on your podcast. I notice you have all these guests, but you're not going in a million directions like you want to get in on the newest trend. You're helping the audience weigh in a very like we don't get shaken very easily. We feel very stable. At least I feel very stable listening to you. And I'm very curious how that and maybe for you it's natural, but how are the things in your life that the experiences that you feel inform that kind of an energy that you show up with?
I think I'm just a learner. I just think that um, I, I feel I am learning on my own show more than I'm just providing a vehicle or a platform for somebody who is smarter than me to actually come and just tell us about a topic that everybody is interested in. And I think just coming with the curiosity lens and just wanting to learn um, is is probably what matters. And knowing the audience is key because we naturally are skeptics about a lot of things as human beings. And it's very difficult to adopt something new, whether it's new technology, new therapy. I mean, it takes a lot. I mean, if you look at our literally the way we conduct our day-to-day life, like literally, just think about from anything, whether it's the grocery store that you usually use to go get groceries, whether it is the gas station you're used to go and fill up your gas, whether it is which Starbucks you go to, if you go to Starbucks or Dunkin' Donuts and so on. And imagine what it will take to change that your routine and that pattern. The same thing when it comes to healthcare and the way you take care of, you have always conducted the way you care for people in a particular way. Even if I bring now new technology for you, it's going to take you a while. Like when EMR came in and we really struggled to get rid of the paper charts. That was before your time, Kim, because you're much younger. But we struggled with this. I mean, it was much easier to write something on a chart. So we, by nature, it takes us a lot to move from our anchor point to a different point. And the same applies in technology. So I usually go into any type of topic that I'm discussing with the understanding that this is
Mhm.
not a foregone conclusion that people who are listening or people who are viewing are going to do the same thing we are suggesting. But I would assume they're curious enough to know, they're curious enough to learn. And as long as I'm able to give them that platform to learn in a non-threatening way, in non-preaching way, that look, this is what's out there, let's just talk about it. I think people appreciate that level of conversation and dialogue. I don't know how this resonates. One of the things I wish I was able to do more is get more feedback and just learn a little bit more. Means not everybody is going to reach out to you and tell you, well, I listened to this and it's good, or I listened to this and it's bad. Some people do and take the time because we can easily find each other. But not every people are busy and they don't always feel that they have the time to reach out to you and let you know and so on. I wish I can tell more about the reception that people have about any topic, but I don't. I think for the most part, it's positively viewed, but there's always room for improvement, as I say.
Well, I really appreciate the time that you've given today. I feel like uh, everything you said, I have to go and unpack now. I have to really like sit
Oh
with
boy!
it.
Oh boy! Oh boy! Don't don't
Don't hurt myself.
don't
Deep wisdom.
unpack. Just take things face value. Much easier.
Oh, but I so much enjoy all the time that we spend together, and I would love to keep on having great conversations like
I
this with
would love
you.
to. I would love to.
Yeah,
Absolutely. Would love to come back on the show anytime you want.
for sure. All right. Well, thank you, and thank you everybody for showing up for value-based care. That's all I have for today. Thanks.